most advanced pacemaker is manufactured, I think it's manufactured by Medtronic. So this pacemaker is so big that it can only be placed under the skin but above our organs. But since this new pacemaker is so small, it's just like a thumb, the size of our thumb, the doctor can directly place this one, put this one into patient's heart. So the advantage of that is less contamination, because your body, once your body is implemented with a device beneath the skin but above the organs, it's your body would treat this as a wound. So the side effect is your body would try to heal the wound, which means the cells would start to grow around this pacemaker to try to cover this wound. And since this wound cannot be healed, it's easy for the patient to become contaminated, and some pus and yellow and inflammation would happen. But this device, once it's put into the patient's heart, usually it's right ventricle. Once it's put into the right ventricle, the inflammation would not happen. So that's the advantage compared to the small size and the big size pacemaker. So this is the Johnson & Johnson surgical cleaning. Cleaning machine. So usually after the minimum invasive surgery is complete, all the tools, the scope, the knife, the blades, the burning device, the burning cut would be put into the cleaning machine, like this one. It's kind of like a giant dishwasher, put into the giant dishwasher and clean it to fulfill the FDA regulation requirements. So basically that's how it works of Johnson & Johnson. It's famous for that. So 3M, we covered it. It's famous for now, it's famous for PPE, personal protective equipment, the gunnings, the whole cover clothings, and the mask. So the reason why 3M is famous for this is they have a lot of patents on materials. They know how to create the PPEs that can both protect the users from, say, very dangerous, contagious bacteria, but also let our skin and our body breathe at the same time. That's their advantages of their material science. And Davinci device, I'm going to spend more time on this one. So here, Davinci system, the reason why we call it surgical robot doesn't mean it's moved by itself. It's controlled by the doctors. And if you can see here, this is on the left one, this is the control panel, right?
Yes.
The doctor can hold the handles in the control panel here. And this is the surgical platform. All the tools associated with this surgical platform is controlled remotely by the control panel, which means a doctor can operate, say a doctor in the United States can perform surgeries for a patient in Shanghai, because this system can be working remotely. So that's the advantage of surgical robot. And another aspect is it's stable. It's quite stable because the doctor's hand can be shaken or can be tired, or the doctor could need some break, or the surgical system could stop and keep as precise as it is. Now, another advantage of this system is you can see the doctor is put his head into the platform, into the panel. The current now to isolate the area of cancer, we use what we call it's coloring. It's a coloring medicine. The coloring medicine can be transferred into the cancer area. Say we know cancer absorbs a lot of energies, which is sugar. So we would put so the medicine company would combine refloroscopy medicines, which is you can just call it as a coloring component combined into the sugar and let the patients swallow it into their stomach and digest it. Once the sugar molecule is digested into the patient's body and be absorbed by the cancer, the coloring component would reflect under the ultraviolet, which is this device can work. So the control panel can switch under normal light and ultraviolet light. So under ultraviolet light, in the patient's body, under the scope, the doctor can locate the cancer area by just checking what area, say, is yellow or blue, which is colored, which is lighting by the color component associated with the sugar. So that's the advantages of this control panel of the surgical robot. So that's why Davinci is the most popular device, and it's also the advancing technology in the entire surgical world. I think but the problem is here, it needs a lot of trainings, even for sophisticated doctors, physicians. If they want to operate this device, they need to perform, I think, at least 118 hours of trainings to learn how to manipulate this device. But for now, that's the most advanced technology in the surgical rooms. So let's move on. So surgical tools, surgical rubber, and hard wells. That's the most advanced product of Edwards Lifesciences. So patients wells, you can see here, they have tricuspid valve and a mitral valve. So mitral valve is the 2 split valves. And the tricuspid valves is 3 pieces valves. So here, the current now, the mechanical or metal artificial valves is for the 2 pieces valves. But for the 3 pieces valves, Medtronic is famous for using cows, kind of like raised cows in California, and just to take out the cow's heart and use the cow's heart valve to replace patients' heart valves. So if you take a look at the picture on the left.
Yes.
So it's kind of close. It's kind of similar. It's kind of similar to the stent, but the stent is going to expand the heart valves. But the artificial heart valves is going to use a stent. It's going to use a guide wire. Usually, the doctor would cut a small incision in patient's leg and use a guide wire to go through that cut into the veins of lung. It's called the aortic lungs. Use that blood vessel. It goes to the patient's heart. once the once the guide wire goes to the correct place, which is here, the aortic valves, the doctor can use X-ray machine to just like this, like here. You can monitor the device be placed into the correct place. After that, they're going to use a catheter which carries the shrinked heart valves like this one or this one, placed into this one and expand it and expand it. So the original, well, what we call is calcified, which means the aortic valve, which has a lot of calcium on it, which cannot operate as the valves without, because like you can imagine if a heart valve has a lot of calcium with